Hello again, everyone. I'm Gene Valasanti. This is Beyond the Podium, where we go one-on-one with the candidates. Joining today is candidate for governor of Rhode Island, Dr. Daniel Muñoz. He's been in with us before. Thanks for coming in now.
Thank you for having me, Gene.
All right, let's get right to it. In your own words, what differentiates you from your opponents?
A lot of things. Lived experience first, growing up in Central Falls, a square mile city, understanding the urban core struggles, taking that struggle, translating it into my career path and becoming a medical doctor, and then jumping into industry to fill that knowledge gap of how does the economy work and how does healthcare as a business ultimately impact the economy. Bringing that into the office of governor in a time where we're still confronting this endemic is very important, given that we have to build out infrastructure with community health, which I believe should be free, and an entire economy that we need to pull out of this next recession, which I think will have a role in the healthcare industry.
Explain what you see as the most important issue facing Rhode Island, the most important issue facing Rhode Island.
I'd love to single it into a single issue, but it's a systemic issue. In healthcare, it's interesting, right? What ends up in the ER, the healthcare conditions, you can often connect back to these social determinants: housing, education, employment. And I think what we really need to do in Rhode Island is focus on grassroots efforts to build things up, change our education funding formula, increase the amount of money we give per student based on needs, weigh it. I think we need a free community health system. People should walk to free clinics like the 90s, but we've dismantled that since. And I also think that when we focus on businesses, not the big corporations, we need to focus on the micro businesses, right? Yeah. Where our local economies are built for, and ultimately we can do that by putting ARPA dollars for these businesses.
Well, since you mentioned healthcare, this next question fits you. How are you uniquely qualified to address that issue? You're an MD.
Right. So as a medical doctor, you're equipped to understand the conditions, the healthcare conditions themselves. But going into industry and really becoming more of an expert in clinical operations and in healthcare supply chain issues, I believe as a state, the way we tackle the current problem we have is figuring out how we increase the number of providers, increasing the Medicaid reimbursement rates, creating infrastructure, legitimate buildings where we can have people go to free clinics, and also creating a medical and dental school that follows a 3-year primary care track where more Rhode Island students can become dentists and physicians that can go into these healthcare centers. That's a 10-year path, but we need a governor that's willing to really catalyze a first step forward using the ARPA dollars, and that's me.
Okay. What is an example of a policy or issue you have changed your view on in the past 20 years? I felt one way, now I feel another. Anything?
Yeah. No, I've been consistent in understanding that there are systemic problems and we need to address them with programmatic changes. What I can say is I'm the candidate in this race that has published, I published my positions in the Boston Globe and other news outlets. I've made it very clear how we can implement a free healthcare system, how we can change the education funding formula, how we can increase the taxes on fossil fuel companies and create categorical funds to support families that are suffering under asthma rates due to pollutants. It's about programmatic changes. It's not just about the policy, but how we implement them. And the governor in this state can create policy and implement it.
What question do you wish someone would ask you, and why?
How many times have I been confronted with offers that would benefit me to get out the race? Because in Rhode Island, that happens a lot. And what I can say is consistently and forevermore, I will turn down every offer that someone makes to get out this race because I'm fighting for all working families, the working poor and the marginalized in Rhode Island.
Who is your political hero and why?
There are many political heroes that I have. We can look at activists like Malcolm X. We can look at Dr. King. We can also look at Bobby Kennedy. People that were willing to sacrifice their lives for what they believed. Those are the heroes that I always look up to.
And finally, what is the best advice you've ever received?
Be still. Sometimes we are so reactive to the issues that are happening around us that we fail to think carefully on how to create sustainable systems. Right. I'm running with plans to create sustainable healthcare system, a more equitable education system, housing that's low income and affordable housing so that people can have roofs over their heads. That's how we help working families in the state.